Hi Cassfield, Dr. Drew here. Now, low back pain is the leading cause of disability worldwide. Over 80% of people will experience it at some point in their life. Now, it impacts the healthcare system so much that in the States alone, it costs them over $100 billion annually in expenses and lost productivity. Now, what is low back pain? It's basically an umbrella term to mean a myriad of things, but boiling it down, it basically just means pain as it pertains to the low back relative to the bones, the nerves, the muscles, the ligaments, and all of the tissue in that area. Now, it can range from something like a dull, constant ache all the way up to a burning, searing pain. It can lead to mild, moderate, or severe impact on your activities of daily living and even your quality of life. How does low back pain even start or happen? Well, at a superficial level, it can happen from a strain or a sprain or an injury that you might have when, say, you were working at the gym or you were gardening, you're cleaning, something random that kind of popped up, tweaked your back a little bit, led to some pain. It can even boil down to repetitive stressors. Repetitive use, for example, where you're at a job where you're constantly moving and lifting objects, utilizing and straining your low back constantly. Or even on the opposite side of the spectrum, where you're not even utilizing your low back at all by sitting chronically at your 9-to-5 job Monday to Friday throughout the whole year. Basically, in all circumstances, what happens is that you have two vertebrae that sit one on top of the other, and in between exists a disc. Now, this disc acts as a shock absorber, and it also allows us to move our spine round and round. Now, the disc is full of water and a lot of collagen and special healing factors to maintain a nice and shock absorbing disc. What happens through repetitive stress or sitting for chronic periods of time is that disc starts to wear away and lose its water content. It loses its potential. And inevitably, it starts to juxtaposition one on top of the other. Now that causes muscle irritation and inflammation around the area, causing the bone to move out of place and start to put pressure on a nerve. Now that pressure not only causes the irritation and the pain that you feel in the low back, but it's also impacting the communication and the flow of information to your organs as well. So, how do we address low back pain? How do we truly get rid of it? Well, the root cause at its fundamental nature for low back pain are subluxations. So fundamentally, the best way to address low back pain is through adjustments. Now, high velocity, low amplitude specific adjustments to subluxated segments is able to reestablish that movement of those bones, take the pressure off that nerve and release that low back area and allow it to heal finally. Now, Dr. Brian and I have seen many patients in terms of low back pain when they first came in and allowed the changes of their own body to not only facilitate short-term changes, but long-term changes as well, to not even just allow and treat current pain management, but also long-term results by preventing low back pain and low back injuries in the future. Now, several studies have even gone so far to evaluate the efficacy of chiropractic care and low back pain. Now, a Cochrane review of multitude of studies found that chiropractic of all manual therapies to be the most effective at addressing and managing low back pain in the patients that were studied. Now, chiropractic care is also one of the most cost-effective, and a recent study even evaluated to show that application of chiropractic care in patients with low back pain was able to drastically reduce the stress, strain, and cost that low back pain disability was putting on the healthcare system. So much so that it was a reduction by almost 75%. It's huge. Best recommendation for in terms of low back pain is get checked, get adjusted. Work on your home care exercises to allow the small postural muscles to respond and hold the curvature of your spine exactly where it needs to be, so that not only low back pain is just treated now, but it will never, ever, ever come back again in the future.